You're listening to podcasts from COVID Gyan, your one-stop resource for scientifically reliable information on and conversations about the novel coronavirus and COVID-19. Hello everybody, I'm Shantala from IndiaBioscience. With the current outbreak and the rapid spread of the novel coronavirus, we at COVID Gyan wanted to take a deeper look at the impact of COVID-19 and the lockdown on mental health. Today, we're talking with Dr. Soumitra Pathare, who is a consultant psychiatrist and the director of Center for Mental Health Law and Policy at ILS. He is also a member of the policy group appointed by the Ministry of Health and Family Welfare, Government of India, to draft a new mental health policy for India. Thank you, Dr. Pathare, for joining us today in this conversation.
Thank you so much, Shantala, for asking me to speak on this important topic of mental health during the COVID emergency.
Mental health is emerging as a very important priority in the current time of the COVID-19 outbreak and the lockdown, which has in fact been extended multiple times. With this regard, can you tell us what we are seeing and what we expect to see?
Mental health is going to be a major problem, not only during the lockdown, but actually even after we've come out of the lockdown. For example, at the moment, what we are seeing is particularly a couple of issues coming up. One is people who already have existing mental health problems. And there's clearly a problem there because we are hearing stories about people with existing mental health problems who are getting a relapse of their illness or who are having difficulty finding their doctors because they are feeling a bit stressed out. Or even worse is hearing stories about people with mental health problems having difficulty obtaining their medication. Clearly, these are three important areas in the current lockdown which affect people with mental health problems. So that's one vulnerable group that seems to be affected quite directly with the lockdown. The other vulnerable group are people who don't have a mental health problem, but who obviously have other vulnerabilities in the background and they were barely coping. And then for them, trying to find any kind of mental health support is becoming a real issue. The third and important group who are probably affected by this is almost everybody. Which is that, the difficulties in obtaining regular stuff, like for many people who are poor, obtaining food or money to continue with their life is becoming very difficult. So there's a whole range of people who are affected by the mental health impact of the COVID lockdown in different sorts of ways. That's one part of the mental health problem. The other part of the mental health problem, which is actually even more worrying, is what we have seen with suicide. What we found, because we've been tracking media reports of suicide, is that there seems to be an increasing number of media reports of suicide. And these reports of suicide have been of different kinds. Initially, in the very first week of the lockdown, a lot of the media reports of suicide were around inability to get alcohol. Subsequently, the suicides have been largely around the fear of getting COVID and also the social ostracization that accompanied with people suspecting that someone might have COVID. And obviously, in the last week, you're seeing another transition happen where a lot of the reasons for the suicides are around not having food or not having money, so that the economic impact of the COVID lockdown is now resulting in suicides. I have to warn, though, that whatever I'm reporting is really from media reports of suicide, and that may not necessarily reflect what is happening on the ground. What we found is that about 60 to 70% of these media reports were talking about suicides by young men under the age of 40. Now, interestingly, this is actually not a vulnerable group either for COVID or for mental health issues.
Thank you for shedding light on the mental health implications of the current situation. The scale of this issue is vast and deep-rooted. Can you tell us what is being done at the level of policy? And based on your expertise, what more needs to be done?
There's a lot of things that have been done. I mean, there's a lot of civil society initiatives. For example, you might have seen on social media lots of civil society groups, NGOs, as well as professional associations trying to put up helplines, which are available and are free for people to talk to if they need to talk to because they're feeling distressed, mentally distressed in some sort of way. There's also been some action from government, in particular, for example, with Kerala. Kerala has done a very good response to it, so that for everyone who is, say, under quarantine, is getting a call from a particular helpline which has trained counselors to do that. Gujarat has also started a similar process now where some of our counselors are also involved in this process in calling up people who are under quarantine to check with them on their mental health status and to offer support and help. So some of these things are already happening, and these are probably the appropriate responses during the immediate crisis. What we need, though, is that as we move ahead, as the lockdown is lifted, as people start moving around, and when the true scale of the economic crisis starts to hit, is when we will need some more specific policy actions from governments. This is a good opportunity for governments to actually look at our public mental health system and to see what are the changes that are required. We've got a national mental health policy which was framed in 2014, but unfortunately, for all practical purposes, has remained unimplemented. So now is the time to pick up that mental health policy for governments, state governments, as well as central governments, to pick up that mental health policy and look at the kind of interventions that are talked about in that mental health policy. That policy was designed by a wide range of stakeholders being involved in the process of policy drafting, and probably represents one of the most up-to-date ways in which we could respond to mental health needs of the population. For example, simple things like looking at preventive interventions, working with children, for example, once they are back in schools, working with providing community-based mental health services for the large population that we have. And this is where using non-professionals, using either health workers who are not necessarily mental health professionals, such as, for example, ASHAs, or even better, using community-based volunteers to provide psychosocial counseling to people who may have any kind of common mental disorders, is something that we should really be encouraging. And I think there are many such other interventions in that policy document. This might be an opportunity for mental health to really be put right in the center of the public health agenda. And I would really urge state governments to do that in the coming weeks and months.
It looks like this is a problem whose impact we're going to feel for a long time and in many different aspects of our life, and on which we need to act immediately. Before we sign off, is there any message that you have for our listeners?
I think the most important message for your listeners is that we are all quite resilient. We've put up with difficult times in the past, and we know that we can come out of it. So there are some things that we can do to take care of our own mental health. Some things such as, don't have an overdose of social media, for example. Listening to news stories about COVID and the number of deaths on a continuous basis is definitely not useful for your mental health. It's also good to actually do very simple things that matter. Simple things like maintaining a daily routine. Routines help us to stay focused, also help us to keep some sense of control over things around us. Exercise is another thing that you might want to consider. We know that exercise is also therapeutic and a treatment when you are having, say, mild anxiety or depression. So these are some of the things that we should be doing ourselves and which we can do ourselves to keep ourselves in good mental health and not get overwhelmed by what is happening around us. And in case you find that after doing all of these things like relaxation, yoga, exercise, having a routine, you're still not able to cope, then remember there's help at hand. There are lots of helpline numbers around, lots of state government helpline numbers, lots of other NGOs which run helplines for this. Pick up the phone and call them. And they have trained counselors who can listen to you, who can help you try and overcome it. There are also psychiatrists and psychologists who have their phone numbers out there, who are willing to offer free consultation during this period of emergency. So if you feel talking to a counselor on a helpline number does not help you, look up these numbers for trained mental health professionals like psychologists or psychiatrists whom you could then talk to. But whatever you do, seek help. It is never such a terrible situation that you can't be helped. And there are people who can offer you help and you can feel better after it. I think we need to realize that you cannot have good health without mental health. So just as we pay attention to our health system, which provides physical health services, it is equally important that we pay attention to the mental health services, because health requires physical and mental health. Unfortunately, in our country, we haven't really had a lot of conversations around mental health. We don't really like to talk about mental health because of the stigma that is associated with it. We don't talk about suicides, although 2.5 lakh people Indians die of suicide every year. So I'm hopeful that this emergency with COVID is going to be a wake-up call for us to start investing in our mental health services. And hopefully that will not only help us now and in peacetime, but also prepare our health services better for the next emergency, if and when it arrives. And it could be any kind of an emergency, not necessarily a health emergency, but there will be emergencies for sure. That's something that we all know. So this is a good opportunity to build a better system for the future.
Once again, thank you very much, Dr. Soumitra Pathare, for joining us in today's conversation and for helping us better understand the impact of COVID-19 and the lockdown on mental health at a personal and policy level. We hope that this puts some of the current happenings into perspective while also giving our audience an understanding of what they can do and where they can seek help. Thank you all for listening. Do take care, stay safe, and watch out for future podcasts from COVID Gyan. For more information on the novel coronavirus and COVID-19, visit us at www.covid-gyan, that's GYAN.in. COVID Gyan is a multi-institutional effort to create, curate, and spread scientifically reliable information on the novel coronavirus and COVID-19. Here you will find answers to frequently asked questions, mythbusters, relevant research efforts, a breakdown of the science of the current outbreak, resources to help you stay fit and healthy in the current times, conversations with scientists, health professionals, and other experts in the field, and useful links that we have curated from across the web. As possible, these resources will be translated into 11 Indian languages. Until next time, listen, engage, and share.